start? Did I hear start? Okay. All right. Good morning, everybody. Thank you very much for coming today. My name is Dr. Hirotaka Yamashiro. I'm a practicing pediatrician in Richmond Hill, Ontario, and I'm president of the Pediatricians Alliance of Ontario, and we represent over 1,400 pediatricians across this province. I'm joined by Dr. Sharon Burry, who practices pediatrics in Windsor. She's the vice president of the Pediatricians Alliance of Ontario. Together, we are here today because Ontario's pediatricians are alarmed about an imminent public health risk for our children. We're also here to say that we want to help. We're the frontline caregivers and children's specialists, and we care about Ontario's children. We have the expertise and the experience, and we're ready to work with government and health policy decision makers. As you all know, recreational marijuana becomes legal across Canada on July 1st, 2018. In our opinion, Ontario is not ready to deal with the risks that it poses to our children. Yes, the government plans an educational campaign for young adults along with other harm reduction measures, and we applaud that. However, there are wide gaps when it comes to children and adolescents. And as pediatricians, as children's specialists for life, we are telling you that they are the most at risk of harm. Their brains are still developing, and research tells us that marijuana use during adolescence can cause functional and structural changes to the brain, leading to damage. Looking at the experience in Colorado, where they legalized marijuana in 2015, a major hospital system there saw a big spike in the number of underage children coming to the emergency room showing signs of marijuana use and exposure. This is called marijuana intoxication. The impact of marijuana intoxication on children is real, can be very serious, and last a lifetime. It's still early days in Colorado and the other states that have legalized marijuana, and it's not yet clear whether the number of underage users of marijuana is going up. However, we can be certain that after next July 1st, many more young people in Ontario will be exposed to marijuana. Consider this. A recent poll done by DART Insight and Communications found that 24% of all adults in Toronto said they will buy and use marijuana when it becomes legally distributed. About a quarter of these people have children living in their homes, which translates into almost 142,000 adults with children in Toronto alone who intend to smoke marijuana when it's legislated. I'm going to repeat that number again, 142,000 adults with children in the home. It's inescapable. There's going to be a lot more marijuana around, and a lot more children are going to be exposed. So we're here to make two urgent recommendations to the Premier and the Minister of Health. One, to develop a public education campaign specifically aimed at parents and children, warning them of the risks of marijuana use on children. The Pediatricians of Ontario stand ready to help should they choose to follow our recommendation. Two, we'd like them to commission research studies so that we can understand and monitor the effects on an ongoing basis that legalization of marijuana will have on our children's health. Pediatricians are again ready to help, and there's a lot of unknowns that we need to know about when it comes to exposure to marijuana to our children. We're not here to relitigate the question of legalization or the age at which young people can buy it. We have clear concerns about both, but governments have made those decisions. We join others in saying that July 1st is too soon for legalization and that we need more time to prepare because we must get this right. However, whenever legalization happens, the public, especially parents with children, need to understand that marijuana use and exposure has been proven to cause serious damage to the developing brains of children. Parents and caregivers should be taking precautions. They should be aware that we don't know all the risks of exposure, and they should treat it like any prescription drug or tobacco product and keep it out of the reach of their children. We have an obligation as a society and as children's health specialists to spread that news. Ontario's pediatricians are here to help, and we hope the Premier and the Minister are listening and agree that Ontario's pediatricians should be at the table. Now I'd like to call on Dr. Sharon Burry to say a few words to expand and illustrate our concerns.
Good morning, everyone, and thank you, Dr. Yamashiro. My name is Sharon Burry, and I'm a behavioral pediatrician practicing in Windsor for over 20 years. This means that I'm on the front line of children's mental health care. I'm already seeing children who are experiencing the harmful effects of marijuana, and I'm telling you, I am really concerned. I would even use the word alarmed about what is happening now and what could happen after July 1st. Let me tell you about some of the cases that I'm seeing. I had a 13-year-old patient diagnosed with ADHD and a learning disorder, and he uses marijuana daily. He's been skipping school for months, and when he does attend class, he's very disruptive. He has symptoms of paranoia, anxiety, frequent arguments with his parents, and he and his father have even asked me to prescribe medical marijuana for ADHD. Then there's a 16-year-old girl diagnosed with anxiety and cannabis use disorder. She's also been dealing with signs of depression, anxiety, poor concentration, and declining school grades. And I want you to listen to this. I'm even receiving consultations for children as young as 4 years of age who have been prescribed medical marijuana for conditions like oppositional defiant disorder, communication disorder, autism spectrum disorder, and attention deficit hyperactivity disorder. Now, we all know that there have been no guidelines set for the use of medical marijuana in children with these conditions. There have been no rigorous studies in this area, and yet children are being prescribed cannabis by healthcare practitioners, and we know it causes brain damage. I've seen many adolescents and teenagers who are not only using marijuana, but using it excessively. And research tells us that these young people are damaging their developing brains. Short-term impairment in cognitive performance caused by marijuana can lead students to fall behind, placing them at a disadvantage for future learning. Also, individuals who begin using marijuana in early adolescence and who chronically use marijuana are at risk for long-lasting, serious mental health disorders like psychosis, schizophrenia, and mood disorders. Not enough parents and children understand these dangers. And also, medical science also needs to understand more about the long-term effects. In 2010, Canadian youth ranked first. Let me say this again. In 2010, Canadian youth ranked first for marijuana use among 43 countries. 1/3 of young people reported that they tried marijuana at least once by the age of 15. There is so much more work to do before we can really safely legalize marijuana. To me, as a pediatrician, legalizing at this time is adding fuel to the fire. We know we already have a problem with excessive use of marijuana among children and adolescents. There are clear health risks to children who are exposed. And so I echo what Dr. Yamashiro has said. More resources for pediatricians who are on the front lines and who are children's health experts. Of course, we need more resources for mental health workers as well. More research into the effects of marijuana on children and adolescents, and public health campaigns to warn parents about the risks, just like we do for smoking and alcohol. Now, while we wish that the age at which someone can legally buy marijuana should be higher than 19, at the same time, we strongly recommend that underage use should not be criminalized. These young people need our help and treatment, not a criminal record. Furthermore, we understand that crafting cannabis policy is a complex matter where decision makers weigh, competing political, economic, legal, social, medical, and scientific perspectives. But we are speaking up now because it's the life work of pediatricians to care for our children. We're gravely worried about what is going to happen to them when more of their parents smoke marijuana legally. We hope that Premier Wynne and Health Minister Hoskins will listen and act. We are on the front lines of healthcare, and we're offering our expertise to help. They just need to call us. I'd like to thank you very much, and we will be happy to answer any of your questions, and we'll also be available afterwards for one-to-one interviews.
What you're calling for a public health campaign, how is that different than what Health Canada is about to launch next month? Because I'm just reading an article here, you know, it's a public health campaign, target teens aged 13 to 17, young adults 18 to 24, as well as their parents and teachers. So what's the difference here?
Well, I had seen that they had asked for a public health campaign, but we wanted the campaign to start from now, exactly, because we have, well, it's starting next month, but they haven't engaged pediatricians, and we want to target parents specifically. Now, in my practice, I hear parents tell me, because we've had a large knowledge gap, that, oh, it's legal anyway, there's no problem, it must be safe. I'm saying that we're already starting too late, but it's good that the government has started, but we want it targeted to parents and young children, and we want to be part of it. We haven't heard,
Absolutely.
yeah.
And to add to that, I think our understanding, this is an evolving story as far as how the government intends to approach the education aspect. I think we're here today because we want to make sure that there's the gaps that we've identified in terms of the different levels of exposure that's going to be a significant issue. We don't want to wait till July 1st of next year for this to happen, because the experience in places like Colorado shows that marijuana intoxication is happening in these are children's hospital. They see children from 0 to 18 years of age coming in with signs of exposure or intoxication to marijuana once it was legalized in 2015. Mm-hmm. So we hope that the Premier and the Minister will allow us to help them in terms of crafting the education campaign specifically for parents. You know, we've done the survey where we see a lot of parents, essentially, or people with children in the household, are going to be using marijuana after next July 1st. And as Dr. Burry mentioned, we need to raise the level of awareness of what the risks are. You know, we warn for legalized products. We have tobacco, we have alcohol. They're legal products, but that doesn't mean they don't come without health risks. And I think for our concern as children's health specialists, we want to make sure that there's a bit of an unknown there. And that's what a public education campaign is supposed to do, is to raise the level of awareness of what harm even products that are legal can do. And you know what fetal alcohol syndrome is, and we warn pregnant women not to drink alcohol. I mean, alcohol is a legal product, but we obviously have a campaign to make sure that people are aware that exposure to that in certain times can lead to serious health problems. And I think that's really the message that we're hoping to bring on behalf of pediatricians.
Yeah. So the point is, we want parents to be educated, and that is very important. And we are also part of the delivery system. We haven't been involved. The community pediatricians are front lines, healthcare providers and experts in children's health. But on the front lines to date, we haven't received anything. We have to get prepared ourselves. So if you're having a public health campaign, which is excellent, and we just want to be part of it so that we can also talk about the risks and the harms to our patients.
You're saying that now Health Canada hasn't involved you in their campaign, in their...
Have you received any information?
We have not. I don't think any doctor in the province has
No,
received
we
anything.
haven't received
and
any. We keep hearing these things, but we haven't. We don't have a toolkit, anything like that.
So perhaps it's coming, but what we're here today is, you know, less than 9 months from now, it's going to be legal. Yeah. And I think you want to make sure that we have a seat at the table to make sure that the perspective of children's health, as children's health specialists, is going to be heard. Yeah. Perhaps they've considered that. They certainly haven't reached out to us, but we certainly hope to hear from them.
Mm-hmm.
Have you reached out to the health ministry on your own yet?
So we have sent him our statement to his office, so we're hoping he's going to take us up on the recommendations that we made.
When did you send that?
I'm sorry?
When did you send that?
I believe we sent that yesterday or today. It was very recently.
So how much information do you receive from the ministries, from the government on marijuana in terms of who to prescribe it to as medical marijuana, and what to warn families, that sort of thing? What kind of information do you receive?
Well, that's a very good question. In terms of when the legislation for medical marijuana came out, it was available for any physician to prescribe, but there were no guidelines saying what to prescribe it for and where the medical evidence lies. As I told you about the cases that I've had receiving consultations for children who are already on medical marijuana, in quotation marks, and they just have to go through whatever procedure the government made. They can call even doctors in other provinces, and they will sign the prescription, and they come to you saying, we're on this. So in fact, that needs to be addressed immediately.
And if I could add so when you talk about the substance and then the various places where you have people who are either prescribed it or exposed to it inadvertently or not, I think the medical marijuana piece, I think it's a really good question that we have, as it happens, this is Ontario Pediatricians Weekend 2017, and tomorrow we have an educational session for pediatricians where we have a keynote speaker from Western University. I like to call it University of Western Ontario, but it's called Western University in London. Dr. Michael Reeder, who's an expert, is the chair of the pediatrics department there, who's going to specifically talk about what he sees as a pharmacologist, toxicologist, and pediatrician about the experience around medicinal marijuana and what's happened so far. But I think you're going to find the same issues, is that without guidelines and without that proper oversight, and that's really why our what we're calling for is to commission official monitoring and research on an ongoing basis, because the unknown around the exposure to marijuana, whether it's prescribed or otherwise, should frighten people. This is not something that we want to wait till June 30th and say we need to worry about this. So that's why we're bringing this to you today.
No, you mentioned alcohol, tobacco. There's no medical alcohol. There's no medical tobacco. Are you concerned that with marijuana, because it does have a medical sort of aspect to the product, are you concerned that parents are going to, be able to purchase it and maybe are going to decide that this is something they can medicate their children with because it exists as a medical product? As a
Yes.
legal medical product?
And so that is why the education campaign is so important, because what the parents are telling me is it's medical marijuana, it's legal, we can just give it. They don't know about the harms, the brain damage, the cognitive function, the mental health concerns of psychosis, schizophrenia, school failure. So that's why we need this to be ramped up, because they're going to have it more available.
Well, and if I could add, you're raising a really good point in that I think this came down, we sympathized at the provincial level. This was sort of brought on them by a federal initiative, right? All provinces are struggling to kind of bring this on. We obviously heard how Quebec is hopefully planning to deal with that very recently. And I bring up tomorrow's talk on the medicinal part of marijuana because we have invited interested media to attend Dr. Reeder's talk. You can certainly talk to our people afterwards about if you're interested in that. But what I want to say about the aspect of what you bring up is that we know what we're struggling with the opioid crisis, right? It starts off as a legal prescription, but then there's street availability and there's all these other pools of availability, and it harms a lot of people in an amplified way. And I think what we're worried about is if we don't get this right now before legalization becomes official, then you're setting yourself up for problems that perhaps a lot of it could be preventable. And
Yes.
and we're here really to focus on the children, because as children's health specialists, for life, this is really what we're focused on, and we're concerned. This is why we're here today.
And just a follow-up question on the plants. I believe Quebec, if I'm correct, has decided not to let people grow plants in their home. Could be wrong, but in any case, do you have any concern about child poisoning from the plants themselves? People will be allowed to keep marijuana plants in their house. I don't know if it's a poisoning risk or not.
Well, we don't want to get into the legal things about it. We really want to focus on what we are here for. We want a public health campaign now. We want to be involved. We want more research, and we want more tools and resources for pediatricians to let people know about the harms and the risks associated with marijuana exposure. The fact that it causes brain damage, mental health problems, school failure, and the like. That's what we want to do.
And it leads to future addictions. So if you think about the wide breadth that pediatricians already have as expertise among our members, our 1,400 pediatricians of Ontario, is they have mental health expertise. There are people who have respiratory health expertise. There are toxicologists. There's a whole host of expertise that the pediatricians can bring to the table. And that's why we're really hoping that the Premier and the Minister will hear our recommendations and take us up on, obviously getting this right.
And this is a serious issue, and the children are the most vulnerable sector in our society, right? And we really have to, as pediatricians, advocate for them, and we have to make decisions thinking about them, things that are going to affect them for their whole lives, and we have to be responsible.
Is it fair to say that the potential long-term negative impact on the brain of excessive pot consumption is those risks are even greater, those potential negative impacts are even greater than excessive alcohol consumption?
I don't know the answer to that question, but we just know it's not good. Okay, so let's not split hairs on it.
No,
It's
absolutely.
not good.
And so the data that we do have, unfortunately, this is actually a very unfortunate thing you see across the spectrum of what we see as children's health specialists, as pediatricians, is that the amount of research, the dollars and the time that's spent on children, let's say between 0 and 12, pales in comparison to what you see with so-called conditions that go into adulthood, HIV and other things, which are very worthy research topics, but we're talking about something that's going to be readily available. A lot of people are going to be exposed. That's a very obvious question parents want to know as well. If my child is exposed to, at age 4, what does that mean long term? Does it mean anything? Short term, we know it affects their memory, their attention span, they miss school, they develop other addiction, they take up smoking, behavioral issues, mental health issues. We know that already happens, but we want to build up that database. And that's why we're calling on the government to formally set up research and ongoing monitoring. So we find out more about this, because that's the only way we can actually then build on further education campaigns around what we find out more about what the harm is.
So, for example, we know about fetal alcohol effects, and we came to that late, but we now know it causes serious health concerns and developmental concerns, lifetime.
Absolutely.
And we know the early evidence is showing that when the fetus is exposed in utero, there are memory problems, attention problems, learning and behavior problems. But as Dr. Yamashiro said, we don't have the research. We need more research, but we already know that it has significant effects.
So how widespread do you think it is that people are smoking pot in their houses with kids around already? I'm not a pot smoker, so I don't really know. But, anytime I'm out, I'm always seeing people smoking outside their houses, smoking cigarettes outside their houses. And I just have the general impression now that a lot of people don't smoke cigarettes in their own homes anymore. But do you think there are more people that are smoking pot in their own homes than cigarettes?
I don't think we necessarily
We don't know that
but
these are the questions, and this is the data that we need. We don't know that. But from the studies, we know that Canadian youth are the top in terms of using marijuana out of 43 countries. So we know that it's a significant amount.
it's out there. And I think you're right. If somebody's smoking something, you're not quite sure what it is they're smoking, but they're visible, and I think that probably becomes part of what we understand the government is initiating, as they should, in terms of a harm reduction strategy, in terms of what are all the avenues where people can be exposed, and how can we limit the exposure where we can. It may not be 100%, but it's something we do. We have a responsibility to obviously try to do that. Yep. Okay, thank you very
All right,
much.
Thank you very much.